Pancreatitis is one of those conditions in dogs that can catch owners off guard, often with very little warning. One minute your dog's fine, the next minute they're hunched over, off their food, and clearly not themselves. And if you've never seen it before, it can be genuinely worrying. Today, I want to walk you through what pancreatitis actually is, the most common signs and symptoms, and what you need to do if you suspect your dog may be affected. I'll also share some tips on prevention, especially if your dog's had it before or is at higher risk. Your dog's pancreas is a small organ tucked just behind their stomach. Its main job is to help with digestion by producing enzymes and regulate blood sugar via insulin. When everything's working as it should, you wouldn't even know it's there. Pancreatitis is when that little organ becomes inflamed, usually because the digestive enzymes it produces gets activated too early, essentially starting to digest the pancreas itself. Unsurprisingly, that causes a lot of pain, discomfort, and potentially serious complications. There are two main types: acute pancreatitis, which comes on suddenly and needs immediate attention, and chronic pancreatitis, which is low-level inflammation that flares up from time to time. Both can range from mild to severe. So what causes pancreatitis in dogs? There's no single cause, but there are a few known triggers. Fatty foods, one of the biggest culprits. Things like fatty meat, sausages, gravy, and oily leftovers can overwhelm the pancreas. Scavenging, dogs who get into bins or eat rubbish off the street are more at risk. Obesity, overweight dogs have a higher likelihood of developing inflammation in the pancreas. Certain medications, so some drugs like steroids or epilepsy meds, may increase the risk. Genetic predisposition, some breeds are more prone, especially miniature schnauzers, cocker spaniels, and terriers. Reggie is actually a schnoodle, so he's a miniature schnauzer and poodle mix, so he would fall into the higher risk category. That said, sometimes it just seems to come out of nowhere. I've spoken to owners whose dogs have been on a consistent diet for years, only to suddenly develop pancreatitis. So even if you're doing everything right, it can still happen, so don't blame yourself. What are the common pancreatitis symptoms in dogs? Your dog might show just one of these signs or a combination. Trust your gut. You'll often just know something isn't right. Vomiting, often one of the first signs. It may be yellow bile, partially digested food, or completely empty retching. Some dogs vomit multiple times, others just once. Loss of appetite. Even food-obsessed dogs will often turn their nose up at meals when the pancreas is inflamed. If your dog suddenly refuses food for more than a day, it's worth checking in. Lethargy. They may seem unusually tired, reluctant to move, or just a bit flat. It's not the same as a sleepy dog, it's a distinct lack of energy or interest. Abdominal pain, and this one's tricky to spot, but signs include hunched posture, restlessness, whining or yelping when picked up, lying with their front legs outstretched and back legs tucked under. The prayer position is what it's known as. Diarrhea, not always present, but when it is, it's often pale, greasy, or foul smelling. And this is due to the digestive enzymes not working properly. Fever or raised temperature. If your dog feels warm to the touch, especially the ears or the tummy, or you've taken their temperature and it's above 39.2 degrees C, that's considered a mild fever. Dehydration, because of vomiting, diarrhea, and or refusing food or water, dogs with pancreatitis can become dehydrated quickly. Gums may be sticky or dry, skin may stay tented when gently pinched. How is pancreatitis diagnosed? If your dog is showing multiple signs from what I've just outlined, especially vomiting and lethargy and abdominal pain, a vet visit is essential. Your vet will likely perform a physical exam, checking the tummy area. They may run blood tests to look for pancreatic enzymes, specifically canine pancreatic lipase. They may possibly do an ultrasound or x-ray to rule out other issues such as blockages, and in some cases pancreatitis is a clinical diagnosis based on symptoms and test results together, not just one definitive test. If your dog has got pancreatitis, what are the treatment options? There's no specific cure for pancreatitis. It's about supportive care, while the pancreas heals. Depending on the severity, treatment may include hospitalization for IV fluids and pain relief, anti-nausea medications, antibiotics if infection is suspected, fasting for 24 to 48 hours to rest the digestive system, a low-fat, highly digestible diet introduced slowly after this fasting period. Mild cases may be managed at home with vet guidance. More serious ones can require several days in hospital, and recovery time varies, but with the right care, most dogs recover well. Some dogs will go on to have chronic or recurring pancreatitis and need a longer-term management plan. That usually involves a strict low-fat diet, avoiding any high-fat treats or table scraps, and keeping their weight under control. I don't know if you can hear, but Dolly is snoring behind me, so I'm sorry if you're picking that up on the sound. With consistency and monitoring, dogs with chronic pancreatitis can still live long and happy lives. I have several customers whose dogs have had bouts of pancreatitis, and under my guidance, we have tweaked their diet with great success in preventing future flare-ups. I have another video coming out about what to feed a dog with pancreatitis, which I will link up here for you, so be sure to subscribe so you don't miss out. How can you prevent pancreatitis? Prevention is about supporting the digestive system and avoiding known triggers. Feed a low-fat, high-quality diet. Stick to a diet that's easy to digest and moderate in fat. If you're feeding raw or cooked at home, work with a nutritionist to ensure that it's balanced and not too rich. Avoid high-fat treats and table scrap. This is a big one. Even a small amount of fatty meat, sausages, cheese or roast dinner leftovers can be enough to trigger a flare-up. Ensure that everyone in the family is on board and no one is sneaking leftovers to your pup on the sly. I get it, we're human, it happens, but it has to be stopped to keep things under control. Keep weight in check. If your dog is overweight, work with someone like myself, your vet or a canine nutritionist, to safely bring them down to a healthy size. Every bit of extra weight puts added pressure on those organs. Don't let them scavenge. Dogs who steal food from bins, picnic areas or pavement are at greater risk. Keep them on lead around risky areas and teach a solid leave it command. Consider digestive support. If your dog's had a flare-up, consider adding things like Kefir Water. By providing digestive enzymes from the kefir itself and supporting a healthy gut, kefir can potentially reduce the workload on the pancreas, which can be helpful for dogs with pancreatitis. Kefir Water is also rich in probiotics, which can help to balance the gut flora and support overall digestive health, potentially aiding in managing pancreatitis symptoms like stomach upset and gas. I will link the product that I recommend in the description below. Tree barks powder. This is a herbal supplement of slippery elm and poplar bark that Dorwest herbs have developed for these types of condition. Because of its highly digestible ingredients and low fat content, adding it to each feed has proved to be very helpful for dogs with pancreatic insufficiency, and it is effective in soothing the digestive system. Again, I will link this in the description below for you. Pancreatitis can be scary, especially if you've never experienced it before, but with early intervention and the right support and careful management, most dogs will recover well and go on to live completely normal lives. The key is spotting the symptoms early and acting quickly. If your dog ever seems unusually tired, refuses food, or vomits more than once in a short space of time, don't wait. A quick vet visit could make all the difference. And if you ever need support with feeding a dog, recovering from pancreatitis, managing diet, or building an appropriate natural routine, please do leave me a comment below. I read them all and I will always answer you myself. If you like this video, please consider subscribing, and thank you for watching. Thanks for that, Dolly.